Blue Prescribing is about using sites like this, like the London Wetlands Centre and other wetland sites, to create structured programmes for this distinct aim of improving people's mental health through access to nature. It came about through a pilot that the Wildfowl and Wetlands Trust did at our HQ in Slimbridge, and it was really positive. And we thought, this is really great, this is working, it works at Wetlands, it works at Slimbridge. Let's see what we can do on a bigger scale at WWT centres, which we have 10 around the UK. So at that point we thought, well, to do this properly, we need a mental health partner, and we reached out to the Mental Health Foundation and we spoke to Jolie.
Blue Prescribing fits in so well with our emphasis of prevention and thinking about how we prevent poor mental health. 70% of people say that they feel less stressed when they're in a blue space.
Often when you go into a natural environment, you're having to exercise more, and so it's a route by which you can almost effortlessly think about exercising. They're really good for social engagements, but it's also an escape too, and get away from your problems which might be happening at home through work or through family life.
The research that we did in the pandemic by the Mental Health Foundation found that particular groups of people had their mental health very negatively impacted by the pandemic. These people are people of colour, people with long-term conditions, and we're going to include in that people with long COVID and also single parents.
Some of the ways that we'll hopefully find people to come onto the course will be through social prescribing routes. I guess a formalised route through the NHS and through social prescribing, but at the same time we'll make the offer available to people to self-refer onto the course as well. And as Jolie referred to, we're really looking to reach out to those people that have been disproportionately affected by the pandemic.
In groups of people, really surprising things happen. And if you take people in an outside environment and they've access to nature and all sorts of different weather and different experience, people will look physically better. We've even noticed that working with people online, which is really surprising. Part of feeling better can be through learning about how other people manage, and it's really peer support, I know on a personal basis, is incredibly valuable and important to being in good mental health.
They talked about how as soon as they got here, the kind of weight from their shoulders was lifted. How could he be angry when he was looking at a goose? Or you can hear a moorhen and a coot in the background there. Another guy would always associate the dawn chorus with insomnia. I've not slept through the night, the dawn chorus is here, I'm going to feel terrible tomorrow. But coming to these sites, he was able to reattach the sound of birdsong to a positive experience. And that was incredibly positive for him. It reconnected nature to him in a positive way. There's this kind of hole at the moment, which is how the third sector services are supported and funded. This one is generously supported by Simplyhealth, which is great. But what we need to do is use that support to try and crack the nut of how these things are sustained. And then, yes, think about how it can expand more nationally at places like this and at other centres that are perhaps more localised and more smaller scale. So there's a big question about how we use the natural environment to leave mental health benefits.
Nature is incredibly powerful for people. We all have a very individual relationship, but people talk very positively about how being in nature really improves their well-being.